Charisse really has all of the factors you don't want to have when you're doing breast reduction and lift surgery. There ultimately may not be enough blood supply to keep her remaining breasts alive.
On this video, we're going to react to an episode of Botched by Nature. And these are people who did not necessarily have surgery before, but have a plastic surgery problem that they basically just developed.
So take us back. When did you first start to develop breasts?
I wore like bras around 6.
You wore bras at age 6 or 7?
Yeah.
She was actually born with...
Little boobies.
Yeah.
Really?
Really.
Most women's breasts start to develop and get larger once they go through puberty. However, it can take many, many years after beginning menstruation that women can reach the level where their breasts are the size that they're going to be long term. For her to be born with breasts is a bit unusual.
So how old were you when your left breast stopped growing?
Like high school.
High school.
So, yeah.
And then the right breast continued to grow past that. Were they ever
No, they've always been like that.
completely different sizes?
A lot of people believe that breasts are made to look exactly the same, that they should literally look like twins. But the truth is that breasts are not made to necessarily be the same. And most women find that one breast is a little bit bigger than the other. Maybe the nipple sits a little bit higher than the other. And this is very, very normal. It is totally natural to have breasts that look like sisters and not like twins.
Did you ever talk to a doctor?
Oh, yeah.
What did they say
We
about
spoke to a pediatrician about it, and she just told us she has to wait till she's 18.
So do you have to wait until you're 18 to undergo a breast reduction surgery? The answer is not necessarily. Excessively large breasts, gigantomastia, is something that we do treat in teenagers. And these are breasts that are so big that they can really impact quality of life. They can impact whether a person can exercise and really live the life that a teenager wants to live. It is in general okay to operate on a teenager with gigantomastia, but you ideally want to wait until their breasts are fully grown.
Yeah, this isn't that straightforward because asymmetric virginal breast hypertrophy is so rare.
So not only does she have breasts that sound like that are really, really big, but she has one that is so much bigger than the other. And this is not super common, but I have seen it in my practice a number of times in the last 15 years.
You remind me of, and this has nothing to do with your physical appearance because you're a gorgeous girl, you remind me of a tortoise. You're kind of like living in a shell. Do you know what I mean? There's Charisse in this shell you carry around. Don't you kind of feel that you're sort of this person because you wear clothes and you're walking around hunched over in your shell, right?
Okay, I really like Dr. Dubrow, but I would never call any woman a turtle. I can't imagine that any female, and really I guess any male, would ever take that as anything but a freaking insult.
Hi, would you mind standing up? Okay. That would be easier for us. Okay. When I look at you, okay, the first thing that stands out to me is that the breasts are incredibly uneven. You know, anything sort of greater than 28 centimeters, that's a really droopy breast.
When Dr. Dubrow mentions 28 centimeters, he's measuring from the sternal notch, which is the base of the neck, down to the nipple. And in general, that distance in most women runs anywhere from 18 to 25 to maybe up to 28 centimeters. However, once you get more than that, now you're talking about a distance that is excessively long, and that shows that somebody is very droopy.
This left one is 34, but the right one is 40. 40 is a lot.
It is very common to perform breast lifts and breast reductions when the distance from that sternal notch to the nipple runs anywhere from about 26 to 28 centimeters up to about 35 centimeters. That's pretty common. So if you're wondering just how long is 40 centimeters for a distance, we're talking breasts that go down to like the belly button type of droopiness.
Well, you need a reduction of your breast where we take a lot more from this side than this side. But this is an extraordinarily high-risk breast.
So why is her long breast a high-risk breast? Well, when we do the operation, essentially what we do is we take the entire breast apart and we keep the nipple attached to a certain amount of tissue. through which blood vessels and nerves can supply the actual nipple. So when you do a breast reduction, that bridge, that connection between the nipple and the chest becomes thinner and thinner and thinner. And at some point, you take off so much tissue that there's not enough blood supply to supply the nipple and the areola can literally turn black and can die. When the breast is so long, the blood supply has to go so far to supply it that risk is much, much higher than a breast that isn't quite so long and droopy.
Charisse really has all of the factors you don't want to have when you're doing breast reduction and lift surgery. There ultimately may not be enough blood supply to keep her remaining breasts alive.
And that is the biggest nightmare that can happen with a breast reduction. I have seen patients, thank God none of mine in the last 15 years, who underwent breast reduction surgery and so much tissue was taken off the breast that the nipple started to turn black. It started to have problems surviving. That is when we bring out our secret weapon, leeches. Yes, you heard it right. I said leeches.
I think your chance of a significant complication is very high. And by complication, I mean the nipple turns black, the wounds have trouble healing, the breast tissue that remains dies.
Those are the things that can happen when you do a breast reduction in somebody who has breasts that are so exceedingly long and droopy. And the key then to preventing that from happening is not taking too much tissue off, is leaving enough tissue to supply blood supply to the nipple and the areola. Unfortunately, that means keeping the breast possibly a little bit bigger than she might otherwise want. And therein lies the rub. This episode is brought to you by my skincare line, Youn Beauty. Our products combine natural and organic ingredients with the latest in scientifically proven anti-aging components like vitamin C and retinol. So if you're looking for healthy and youthful skin without the unnecessary chemicals, this is the skincare line for you. Check them out at dryounonline.com and use the coupon code 20OFF to get $20 off your first order over $99. We'll put a link in the caption below. All right, back to the video.
So I'm gonna start with our problem child, but I'm gonna lift both of them today. Ideally, what size would you like me to make you? You wanna be a C?
Well, if that looks nice, I don't want them to be flat. I just want them to be nice. I want them to sit up.
So making her a C, that could be a real challenge. So when I do breast reductions in patients like this, where they are so big, so long, I usually tell them that I can't guarantee you a certain size. I don't know that I can get you all the way down to a C, but I will get you as small as I safely can.
For Charisse, I'll start with liposuction, making them as even as possible. Finally, I'll give her a lift by removing the extra skin and making her areolas smaller, which should result in symmetrical and reasonably sized breasts.
Liposuction the breast is not something that is super common. Now, you can liposuction the breast in this situation if she has a very fatty breast, and that might help remove some of that tissue and get the breast a bit smaller, and it's very safe to liposuction a breast. But the problem in most women is that a good portion of the breast is made up of glandular tissue, not fat. But glandular tissue has the consistency of styrofoam, and you can't suck it out with a liposuction cannula. You have to cut it out with a scalpel. So I think he's trying to do liposuction as a way to reduce her breast size as safely as possible, but the question is, will he be able to remove enough tissue via liposuction to give her the size that she wants?
What I'd love to do is get 1.5 liters out of this breast. What are we now?
So 1,000, yeah.
1,000. Barely making a dent. It's bigger than a basketball, isn't it? Yeah. Oh. Okay, so what have we suctioned out? 2
liters.
So let's suction the left breast down to about this size. So we'll do 800 to 1,000 cc's on this side.
In general, this is not how I would reduce a person's breasts. You would usually cut the breast open, remove the extra tissue, and bring things back together. Now you could liposuction and then cut out the extra skin as a lift, but the big question is are you going to be able to remove enough via liposuction to give her the size that she wants? Because if you can't, now you got to go and start cutting into the breast, and then what's the point of having done the liposuction before?
So we've suctioned the right of 2 liters and the left of 750 roughly. The right's still so much bigger than the left.
Now, if you look really closely, you can see that he has actually put the breast together using staples. And before you think that that's gross, like, oh my gosh, he's using staples on a breast, that is actually how we tack things together in surgery to get an idea of how things will look before we actually make the cuts on the breast. I do the same thing.
Cut the right and reduce it by direct excision, which is potentially dangerous.
Sharice's breast tissue cannot be removed entirely by liposuction because a certain percentage of her breast is actually breast glandular tissue, which the liposuction machine does not remove.
Now, in my opinion, combine the two, liposuction to the extent that he did with a traditional breast reduction may not have been the best idea. And the reason is if he liposuctioned through some of the blood vessels that are needed to supply the nipple and the areola, he may have damaged them, causing her to not heal as well as she otherwise would have had he started by doing the traditional approach in the first place.
Okay, so they're symmetrical. The nipples are exactly the same heights now, and the nipples are alive. I think we did this.
Ooh, he took a bit of a gamble and it worked out for him. It looks pretty good. Now, if you look real closely at that, if you back this video up and you look real closely, you can see a lot of little wrinkles on the underneath scar underneath her breast. These wrinkles will almost all completely go away, believe it or not.
Of course, what I'm worried about now is how swollen are you, and are you swollen so much that you've cut off the blood supply to your nipples? So we want to take a look and see. So it's swollen, but look at this thing.
Very pretty.
Yeah.
I'm excited about this size because they make bras in that size, cute ones.
Here's the question. That is an alive nipple. That one is not. No, I'm kidding. That one's alive too.
Don't do that.
I know.
So that's great news because if the nipple looks good at your first postoperative visit, it's very unlikely that she's going to have a problem with it afterwards. And it sounds like she's really happy with her size so far as well.
Your breasts are alive. They're symmetrical.
I was like looking online, like they have cute little bras with lace.
Look at you. You know, you have so left your old breasts behind.
If you look at her face in this appointment, that is the look that I love to see in my patients. You take somebody who has these insecurities, and sometimes with good reason, and you get rid of those insecurities and you turn it into something that they feel confident about, and they get that look in their postoperative appointment, and it really makes doing this job totally worthwhile.
I've wanted this surgery for so long. My breasts were huge, uneven. They made me feel so self-conscious that I felt the need to hide my whole life. It was horrible. Before surgery, my breasts were so big and so uneven, they made me feel less confident about myself. Now, after surgery, my boobs are smaller and evenly sized. After all these years, I finally feel like I'm coming out of my shell and it feels sensational. So on a scale from 1 to 10, I'm like 12 with how excited I am about the surgery. I couldn't be happier with the results that I have.
Great job to Dr. Dubrow for taking on such a challenging operation and hitting that out of the park. So she may have been botched by nature, but what about those people who are botched by bad doctors? Well, take a peek at the playlist right up here where I react to different episodes of Botched and give you my opinion of what's going on from a holistic plastic surgeon's point of view. If you've been enjoying my videos, please subscribe to my channel, and always remember, eat real food, use clean skincare, and only consider actual plastic surgery as a last resort.